Good evening, ladies and gentlemen, and a very happy new year to everyone. We are back with our CERCA monthly expert talk series for the year 2023. And this month in January, we are very delighted to present before you Dr. Polash Mukerjee, who is the lead air quality and health at NRDC India program. Well, Polash is a researcher and a policy advocacy professional with over 8 years of experience in environmental health, air quality management, and climate resilience. He works closely with a diverse set of stakeholders spanning state, civil society, and private sector actors at the national, regional, and city level to improve environmental governance on air quality and extreme heat. His expertise is in developing emission reduction roadmaps, financial and regulatory environmental health governance tools, clean fuel and vehicular technologies, assessing air pollution sources, and as well as communications and outreach. He has worked on environmental governance and developing as well as implementing sectoral strategies for clean air, public health, as well as sustainable mobility, including the National Clean Air Program and regulations around emission control. He is currently leading the Natural Resources Defense Council India's work on air quality and health in India. He also supports work on clean mobility, international climate policy, as well as communications for the India team. He began his career at the Center for Science and Environment, New Delhi, where he worked closely with APCA, a statutory environmental governance body. He has a master's degree in developmental studies from the Indian Institute of Technology, Madras. And Polash can speak at least 4 Indian languages, and he's an avid traveler. He's based out of NRDC's Delhi office. Well, Polash would be speaking on improved health benefits of air quality and climate actions, the case of Ahmedabad, Gujarat. Climate change, extreme heat, and air pollution are connected public health threats. Outdoor air pollution imposes an enormous public health burden across India, contributing to an estimated 980,000 deaths in 2019. In Ahmedabad, Gujarat, researchers from an NRDC lead consortium have been working to generate evidence quantifying these dangers at a local level using city-specific population, health, and air pollution data, and the ways in which city-level actions are working to address air quality and public health risks. This talk today will highlight local actions and a new research study in Ahmedabad focusing on the intersection of air quality, climate change, energy, and public health. It will also discuss how new evidence can provide a rationale for strong mitigation and adaptation actions in other Indian cities, as well as how these methods can be used effectively to quantify the health benefits of air quality and climate actions. Over to Polash.
Thank you so much, Hemantji. At the outset, I'd like to thank CERCA and IIT Delhi for the invitation to speak at these monthly lecture series. I'm very privileged to be given this opportunity, and I'm to be able to share some of our work. Like you did mention, this work that I specifically am going to be speaking about is on the basis of an NRDC-led consortium. So it's not just my individual work or even my individual organization's work, but I'm very happy that I'm able to take you through this. So I have a short slide deck, about 25 slides, and I'll be happy to take any questions at the end of it. Unfortunately, I can't see the chat window while I'm sharing my screen. So I'll get to the questions towards the end. So good evening and Happy New Year, everyone. Thank you all for joining us at this time. Like Hemantji said, my name is Polash Mukerjee, and I represent an organization called NRDC India. NRDC stands for the Natural Resources Defense Council. Just a minute. NRDC stands for the Natural Resources Defense Council. We are an international environmental organization. We are a civil society group. We have more than 3 million members. We have more than 3 million members, and we've been working on the environment since 1970. We are a 50-year-old organization. We work in the United States, China, India, Canada, and Latin America as well. In India, we've been working on the environment since 2010 in very close collaboration with local partners. Some of our partners are listed down here, including the city of Ahmedabad, the city of Pune, pollution control boards in these states as well. Now, just a quick introduction about where we work. We work in pretty much these highlighted states in India, and our areas of work are on the left side of the screen. We work on three main thematic areas. We work on clean air and healthy cities. We work on renewable energy and energy access, as well as we work on cooling and efficiency. And this particular work that I'm going to talk about is from the city of Ahmedabad, where we have worked for more than 11 years now. NRDC's work in India began with the work on heat health. We've been working on heat health since 2009, and it really began with the city of Ahmedabad taking the leadership on heat health and putting together South Asia's first heat action plan in 2013. The work on that began in 2011, and subsequently we've been working with partner cities, partner states, as well as the national government through the National Disaster Management Authority, as well as the NCDC, the National Center for Disease Control, that's part of Ministry of Health, on extreme heat. Why I talk about heat is that there is a very close linkage with heat and air quality, as we have come to realize in our study. On air quality as well, we've been working in India since 2017. Here again, we began working with the city of Ahmedabad. Some of the graphics that you see here are from the Air Information and Response Plan in Ahmedabad that was developed by the city in 2017. Now, what was this Air Information and Response Plan? This was a health risk and benefits communication program that the city began, where the forecast for air quality for the next 3 days were disseminated widely to vulnerable groups, including students, including outdoor workers and marginalized workers, through a variety of communication channels, including public LED boards like the one you see on the left. Since then, we have come to work on other areas in air quality as well. We've been working closely with NCDC to try and increase the robustness of the monitoring network for health, monitoring health outcomes of air quality. As you may know, this is a drawback that has been pointed out in NCAP as well. The fact that NCAP, while it may be linked to air quality reductions, the ultimate outcome that we are seeking here should be gauged in terms of health improvements, and that is what we are making efforts to monitor. We are also looking to build evidence and knowledge base for sectoral air quality interventions in some of our partner cities. And the third area that we are working on and we hope to work on more strongly in the future is to strengthen capacities for better integrated air quality and environmental health governance. Now, I use the word integrated quite carefully here because, like you see, in Ahmedabad city, there is a convergence of our heat work and our air work, and that proves to be quite important. Both these are climate-linked disasters that are becoming worse over time and require deep and strong responses from the state authorities, from the local authorities, to with an outcome to improve health statistics. So in Ahmedabad, both these plans kind of converged, and there was good response from both the state government as well as the municipal corporation there, as well as the local civil society that saw a strong response for both these areas of work. Now, what is this project all about? Like as most of you, I'm sure, know, Indian cities do face a serious and intensifying health risk from climate change, and for the purpose of our work, from both extreme heat and air pollution. The intensity and the frequency of heat waves is something that has been increasing over the last decade. In fact, the statistics say very strongly that I think 2 of the 10 hottest ever years have been in the last decade. So to counter this, there are a number of national policy responses. Of course, at the macro level, the climate change targets exist that India is committed to at the international stage. There are also national and state level targets now that have come into place. There are also heat action plans and the implementation of cooling mechanisms such as cool roofs. I'll come to that in a short bit. These form a part of India's National Cooling Action Plan. This is something that the government of India has rolled out from the perspective of our international climate commitments. Again, given the impact of cooling products on greenhouse gas emissions and on global warming. To add to this, there's the National Clean Air Program, which is the one that I'm sure a lot of people in this room on the attendance are familiar with. The National Clean Air Program focuses on the achievement of our national ambient air quality standards within our cities, and there are more than 130 cities nationally that don't meet these standards. This picture on the right is from the city of Ahmedabad on a particularly polluted winter day. Now, this particular research that I'm talking about, we started this research work with 2 questions in mind, and these kind of formed the basis of the entire project, which was a 2-year-long project that had four different organizations involved in it. The organizations were the Natural Resources Defense Council, the one I represent, the Indian Institute of Public Health in Gandhinagar, the Gujarat Energy Research and Management Institute, GERMI, again in Gandhinagar, and the Indian Institute of Tropical Meteorology in Pune. These were the 4 institutes. And the questions that we were looking to address were the following: how might climate change trigger demands for air conditioning affect local air pollution levels? What this means is that when we are seeing increased heat and increased temperatures and increased heat waves, the demand for air conditioning is skyrocketing year on year. So what would be the interface of this and localized air pollution? So that was one of the questions. And the second was, on the other side of things, that what would be the local benefits of city level mitigation and adaptation actions for both air quality and for health? So these were the 2 questions that we sought to answer. And I'll walk you, the rest of my presentation is going to be walking you through what the project was about and how we got to where we did. So this is a broad overview of the project. So we were looking at a climate change scenario of 2030. So we were looking at a 2018 baseline versus a 2030 end line. And we assessed the energy demand for cooling specifically for Ahmedabad. So we were very happy to be able to do this research at the city level, because to our minds, such kind of research may have been done at the national or even the sub-national or state levels. But what a city needs to do is quite crucial. So here we assessed the energy demand for cooling that would arise between 2018 and 2030, specifically for Ahmedabad. And then we looked at 2 particular mitigation and adaptation scenarios. The mitigation scenario was in line with India's international commitments and also the state of Gujarat's commitments. The chief minister had said that they would be transitioning away from coal to increased renewable adoption, increased RE adoption. So that was the mitigation scenario that we considered. The adaptation scenario that we considered was the greater adoption of cool roofing techniques and cool roofs as a part of city level suite of solutions that the city of Ahmedabad is adopting. So these were the 2 scenarios that we considered. And we had a 2018 baseline for air pollution. We did a 2030 model of air pollution based on the increased demand for cooling, as well as certain other benefits, which are certain other assumptions, which I'll just go to the next slide. And aim 3 is what we were looking to find, which is, I think, quite significant for this this session, is what would be the health co-benefits of actions that would target both extreme heat and air pollution. So this was the study area that we looked at. This is the state of Gujarat, and the district in yellow is Ahmedabad, while the district in purple is Gandhinagar. So the dotted lines represent a 50-kilometer and 100-kilometer radius, and the black dots represent power plants in this area. All 5 of these power plants contribute to to the energy requirements that the city of Ahmedabad or the union agglomeration of Ahmedabad has. But for the purpose of this study, we looked very closely at power plants 1 and 2. So these were the assumptions that we took as part of our study. We looked at a 2030 energy mix that the CEA, the Central Electricity Authority, had kind of estimated for the country. We also took into account population growth by 2030, increased demand for air conditioning due to economic growth by 2030. We also modeled land use changes that other secondary studies had looked at. And we estimated PM 2.5 emission increases from other sectors as well, including transport, including industrial emission, including waste sector, and so on. But we did also consider, like I said, only a subset of these 5 plants that affect both local air quality and that contribute to local energy demand. So I'll just go back quickly to what the scenarios the mitigation and adaptation scenarios that we looked at were. For mitigation, we assumed better compliance with the thermal power plant emission standards, as well as movement away from coal towards renewable energy, as outlined by India's international commitments. And for adaptation, what we were looking at were cool roofs. Now, what is cool roofs? Now, cool roofs are a very low cost and low technology solution to reduce the impact of extreme heat, specifically on indoor temperatures. They work through reflecting incoming solar radiations, and they deliver multiple benefits. So, a picture you see on the left here is the most basic application of cool roofs. So cool roof can be done through a variety of different materials and solutions. But this particular one is essentially a kind of paint which increases the reflectivity of the roof surface. So this would mean that most of the incoming solar radiation gets reflected rather than being absorbed. And therefore, over a period of time, there is a significant reduction in the indoor temperature on hot days. Simultaneously, there is also a reduction in the load on cooling equipment. So because the indoor temperatures are reduced, the requirement for you to operate your air conditioning unit in terms of number of hours or in terms of the energy consumed, that reduces significantly. Now, cool roofs is something that Ahmedabad is already rolling out as part of its heat action plans for several years now. In fact, in 2017, Ahmedabad was the first city in India to kind of pilot out these cool roofs. And here, the targeted application of cool roofs began with applications in low-income scenarios, specifically low-income housing societies, slums, where access to cooling as it is low at the moment. But very significantly, in the next 8 to 10 to 12 years, that's where the greatest demand for additional cooling is likely to come from. So cool roofs, therefore, is a solution that emerged out of our heat work. I've put together a link here that is our latest fact sheet on cool roofs, and it talks about how cool roofs, if it were to be made part of our India's national cooling action plan, how it could address the rising demand for cooling. So this is an exercise that we did do. We assessed the total roof area of Ahmedabad, and we therefore looked at what percentage of that area could be potentially covered by cool roofs and what impact that it would have on energy demand. This work, the Gujarat Energy Research and Management Institute led, and I'd encourage you to look at their paper. I'll link that again at the end of this presentation. So this was kind of the projections that we had for cooling demand. What you can see here is that between our baseline in FY18 and our end line in FY30, there is almost a 3x increase in total demand for cooling. And most of this increase comes from space cooling, which means your air conditioners that we operate in our homes, in commercial spaces, in offices, and so on. So, what were the results of this on energy demand? So, we modeled that under the 2030 business as usual scenario, the power supply from one power plant that is situated inside the Ahmedabad city limits would increase slightly. Under the mitigation and adaptation scenario, the coal energy supply would be replaced by renewables that could make up for energy supply to the city. Now, what were the results here? So we are under the M&A scenario, we assume that the cities would cover 20% of its roof with cool roofs, which means that there's a significant room of 80% more that could be done. But this 20% would be up from 5%, which would come under the BAU scenario. So this increase in cool roof adaptation would reduce cooling energy demand by 0.21 terawatt hours. This may seem like a small number, but this is the equivalent of 80,000 cars operating for one full year. So this is a significant reduction in cooling demand that can be brought on by the adoption of cool roofs. Now, what does this have to do with air quality? So this is the cool roof assumption that I did tell you. Now, for air quality, there was a detailed air quality modeling that we did, which was on a graded basis. We looked at IITM, the Institute of Tropical Meteorology, to take the lead on this, and it did emerge that the BAU scenario versus the M&A scenario, there were significant changes in air pollution that could emerge. This meant that one second, let me just, I think the slides are mixed up. So this would mean that under the baseline, while annual average PM 2.5 in Ahmedabad is 63.4, if you weight by population, it's 71. Under the business as usual scenario, this 71 would go up to 75, and the population would also go up significantly. Under the M&A scenario, where more renewable energy is adopted, there would be a significant fall in annual average PM 2.5 of 5 microgram per cubic meter. While this seems insignificant, or rather not very significant, you have to see that this takes into account all the other sectoral inputs. So this takes into account your transport, your industrial emissions, your waste emissions, your transboundary emissions, all of those scenarios. So those were the air quality findings. As you can see on a graded parameter here as well, there is significant improvement in relative improvement in air quality in the vicinity of the power plant that we looked at for city of Ahmedabad. The next step that we looked at was trying to convert these air quality benefits into health impact estimates. And this, I feel, is quite significant for the kind of decision making and for decision makers that we have at the city level, at the state level, because this kind of a methodology can be used to then estimate the health impacts of any potential or planned intervention into air quality. So we used a tool called BenMap here. BenMap is an open source tool that was developed by the US EPA, but very importantly, it uses localized data sources for both air quality as well as for health. So here we used not just the 2018 pollution baseline, but also the 2030 modeled pollution emissions. But we looked at health data from the city. So we were able to collect from the city health data at a zone level. We were hoping to get it at the ward level, but we were able to get it at the zone level. And we were able to, based on the baseline that we had for 2018, and based on the change in air pollution levels, we were able to estimate the change in the number of annual deaths in 2030 that would be caused by our specific intervention that we had modeled for. So that is the result that we find here, that the mitigation and adaptation actions that we had resulted for, they account for 1,414 fewer deaths per year by 2030 compared to a business as usual scenario in 2018. This, I believe, is a significant finding where we are able to specifically put a number to the health benefits of any perceived air pollution action. Like, for instance, if tomorrow any other city were to say that we would do action X, and the benefits of that would be reduction in pollution PM 2.5 levels, we now have a method to estimate what the health benefits of that would be as well. Subsequent to our study, this was something that we did to extending those benefits not just to the scenarios that we are modeled for, but also to see that if Ahmedabad were to meet the NCAP target by 2030 of 40% reduction over 2017-18 levels, then that would mean that the annual average PM 2.5 levels would be 49.73. Mind you, this is still not meeting our national ambient standards, but even a reduction by 40% would mean that 6,510 mortalities would be averted annually on an annual basis. Similarly, if we were to extend these targets upwards to meeting the national ambient air quality standards of 40 microgram per cubic meter, that would result in a significant increase in the number of averted mortalities. And this is for WHO air quality guidelines, which were revised earlier last year. If the city of Ahmedabad were to meet the WHO air quality guidelines, the health effect estimated would be a version of 17,369 deaths. So therefore, what is this study's significance, and how do we think? What do we think is the way forward going for this? So here we've been able to generate evidence that breaks across sectors. We are looking at extreme heat. We are looking at climate action and climate targets, and we are looking at air quality, which are erstwhile looked at by very separate departments, even within the government. So this is a pitch for cooperative and joint action, which can affect climate policy decision making. These kind of interdisciplinary evidence can identify the lowest hanging climate and air pollution interventions that could maximize the health co-benefits for a particular city. This also significantly points out what the shortcomings of this kind of an approach are in the current scenario. Like, for instance, in Ahmedabad, the granularity of the data that we were able to produce was restricted by the availability of health data. Health data was available in Ahmedabad only at the zone level, and therefore we were not able to go do a further deeper dive into this. Similarly, our climate goals include substituting highly polluting fossil fuels for renewable energy benefits. Decision makers, therefore, should potentially consider air quality as well as the health impacts of climate and energy policy, something that is not done very strongly at this time. So that was the study. This was the project team and the organizations that we represented. So there's 4 organizations here. We've put together this fact sheet, and which we launched at an event last month. We have the fact sheets in both English and Hindi at this link right here. And I'll leave you to this. Potentially, this is a focus area of the applied work that we've been doing here, saying that in the sense that many cities and states have been working on these city-based clean air action plans as part of the NCAP. What is missing in many of them is the linkage to their perceived health outcomes. So this is a tool that could potentially be used to identify what the health outcomes would be of particular actions, and therefore prioritize action based on their health improvements on the city population. These are links to the journal. They're open access, so I'd encourage you to look at it. I'll ask CERCA to circulate these links after my presentation. Thank you. I encourage you to write to us for more details and questions that you have. I'm also looking forward to answering any questions that may be present. Thank you.
So thank you, Polash. Now I'll request Priyanka and Geetika to moderate the question and answer session.
Sure. Thank you, sir. And thank you so much, sir, for such an informative talk. Next, we'll now move to our QA session, as we have some questions posted by our participants in the chat box. Taking the first question, to what extent do you think that the occupants' adaptive actions like window operation, fan use, and ventilation controls can significantly play a role towards controlling the indoor environmental conditions?
Thank you, Priyanka, for that question. I definitely think this is an area that is being looked at very consciously. In fact, if you look at our Prime Minister's motto of life and the interventions there, the focus there is on behavioral change. It's on what an individual can do to change his or her behavior, and to minimize the overuse of cooling equipment to begin with, and the impact that they have on global warming. So adaptive actions do have a big role, specifically for avoiding extreme heat outcomes. There are heat-related illnesses that are looked at very closely, and I think built spaces contribute to that significantly.
Okay, sir. Moving on to our next question. Cooling roofs by coating white paint or chemical. How effective is this method? Can it be an alternative to air conditioning? It will be effective only for the roof of the top floor and not for the floors below. If you could share your comments on it.
Sure. Thanks, Veer, for this question. I think cool roofs can definitely help in reducing indoor temperatures. In fact, cool roofs, there are studies that have been done in the Indian context that have found that cool roofs can reduce indoor temperatures by 2 to 3 degrees. And if implemented over a large area across a number of roofs there, they could reduce ambient temperatures as well significantly by reducing the urban heat island effect. So while it may not be an outright alternative to air conditioning, it could definitely reduce your requirement for air conditioning. It could improve your economic expenses by reducing your AC bill. And also, it's not just effective for the top floor. It's most effective for the top floor because of the surface area. But if you have a south-facing building, the walls of the building also absorb a lot of heat. So it's cool surfaces. There's a lot of work on this that's looking at entire surfaces being covered by this. Again, there are different technologies that can be adapted to different use cases. But for certainly the impact on this, on something like this on air quality is something significant and must be looked at.
Moving on to our next question. How can we look at the climate change and its impact on the financial markets?
Thank you, Nishchay. But I think this is a very broad question. Uh, Climate change definitely has an impact on the direction in which financial markets are going. But I think I can address this by trying to see what the other way around. What can financial markets do to address climate change impacts and definitely look at opportunities to strengthen responses on climate change? This is something that our organization is involved in quite keenly. There are certain avenues which remain underfunded, like for instance, municipal finances for interventions like cool roofs or for air quality interventions. The 15th Finance Commission funding is highly significant because for the first time it is dedicated funding to cities on air quality. However, I think it is stifled by limited capacities at the city and state levels. In many cases, local bodies don't have dedicated teams required to maximize the utility of these funds and to identify what would be the most effective area where these funds could be used. That's where tools and studies like this could come into play in a big way. It could also financial markets could also be leveraged to see how capacity strengthening and institutional strengthening can be promoted in the long term.
Our next question is, how did you come up with the gaps in data while preparing WenQ map, as it requires data of different age groups and disease burden in the past years?
Thanks, Sandeep. We for the health data modeling for BenMap, we were able to find fairly robust data for the city of Ahmedabad. This has also been because we've been working with them for many years, and we were able to receive data that was aggregated at the, like I said, at the zonal level. However, in terms of disease burden of past years, as well as data for different age groups, we did not have those exposure response functions specifically for the Indian context. And those were something that we did use existing global functions for. However, I still maintain, like I said earlier, that health data is the most defines the lowest level of granularity, because in the city of Ahmedabad, we still had access to this kind of data, but for most of the cities, it's quite hard to come by.
Okay, sir. Sir, our next question is regarding the economic growth in 2030. It was used for modeling the emissions in 2030. Did you use the city level projected economic growth? And what was the assumption used for the modeling, as it is one of the most prominent factor affecting the emissions?
Thank you, Priyanka and Samraj. So we did use city level projected economic growth. This was on the basis of this was on the basis of reports that were generated by secondary studies. But particularly for cooling demand, there is a national level study that the India Cooling Action Plan is heavily based on, and we were able to, based on population estimates, extrapolate that and break that down into a state and then city level estimates. I can look at further details if you have any questions about what particular factors we used. I'd be able to get back to you on this. Definitely.
Okay, so our next question is regarding this cavity walls may have usefulness along with the roof cooling in lowering the temperatures. But how incentives are provided in addition to the other benefits to drive a behavioral change at a pace?
Right. I think this is a little bit of a comment rather than a question. Cavity
Yeah.
walls are definitely useful. How incentives are provided is also a part of behavioral change. I think what we need to understand is many of the incentives here are in terms of reduced operational costs as well as in terms of reduced health expenditure. Uh, these are the parts that are very significantly missing from many analysis, that what are the health impacts of added air pollution or extreme heat. The air pollution, the health impacts of air pollution are often derived only at the very macro levels. Like we know the global figures, or we now know the figures for India, but you don't, you fail to associate very strongly with them because it's at a very disaggregated level. So communicating effectively the health risks as well as the health benefits of air quality is a key part of this solution.
So moving on to the next question. As we witness severe data gaps in the health data, what in your opinion can be done to improve the overall health data in India for the better policy recommendations?
Well, in the areas that we work on, I think there are some ongoing efforts for better health reporting. But as part of what we have also, I'm sorry about that, that's my dog. As part of what we have also been saying about as part of this study, interdisciplinary work and representation of public health voices at decision-making forums is the first step to begin with. Like for instance, what we're saying here in terms of air quality is that the NCAP does not identify a role for health representatives, which could be the state health departments, or it could be even the health department at the city level, to play strongly to reduce air quality. So while health outcomes may be the eventual impact that you're trying to influence, how you will go about it will only come if you're monitoring it at a regular intervention. So inclusion would be the first step to do that. But going forward, more robust programs like the National Program on Climate Change and Human Health that the NCDC runs would be key tools for this.
Okay, thank you so much, sir, for the answers. Now I would like to invite my colleague Priyanka for a formal vote of thanks.
Thank you, Kirtika. On behalf of CERCA, I want to extend my sincere thanks to Polash for having accepted our invitation to deliver this expert talk. And it was really a real pleasure and honor to host you as an expert speaker this month. So I finally want to thank all the participants representing from the different sectors who took time off from their took time off for attending this talk and making this session interactive through this Q&A session. Thank you once again, and we will announce our next scheduled talk via email and social media's handle very soon. Thank you.
Thank you, Polash, and thank you everyone for participating.
Thank you everyone.